Good afternoon. I'm Dr. Robert S. Brown from Fort Lee, Virginia. As you know, that's a TRADOC post with combined all services, and it's been my privilege to work there for 10 years, almost exclusively with soldiers with PTSD. Today I want to discuss what I'm calling the puzzling case of the whatever syndrome. And I'm going to ask you to participate in this, to see what you can make of the case, because I'm a little bit baffled by it and wondering how to proceed. And I'd like for you to contact me after you've seen it and thought about it, and contact me on my email, which is sacredgroundmedia@aol.com. The soldier about whom I'm going to speak has seen this video, and he's doing it because he wants you to learn about the condition he has, and you may have some symptoms like him. I call it a puzzling case of the whatever syndrome for this reason. I saw him in my office. I think it was the first time I'd seen him, maybe the second time in my office in individual therapy. And he said, with the seriousness of a person taking an oath of office, "You can show me the most beautiful sunset in the world, or you can tell me about your best friend dying, and my reaction is going to be the same. Whatever. I have no feelings. Whatever. I'm not happy. I'm not really sad. Just whatever." Now, use the idea that patients bring us their solutions and not their problems. And our job as a psychiatrist is to look for the problem. That's what this exercise is about. What is the problem to which the feeling of whatever is the solution? He's had a number of combats in deployment situations with the worst kind of warfare, but he does not want to talk about that. And I thought it was too early to talk about that anyway, because I like to have a trusting relationship with the patient before we begin to explore the most painful parts. He said, "I have felt this way for a long time." Now, his first deployment was in the beginning of the war, 2003, 2004. So we're talking about memories now that go back 12, 13, 14 years ago. And he's been in the Army for 15 years. He joined the Army right out of high school. And this is his story. He was born in a Midwestern town. His parents were divorced before he was old enough to remember how old he was. It was understood that he would live with his mother, but spend Christmas and summers with his dad. His mother inherited some money when her mother died, and they went off to live in a small town in the east. It wasn't much money. It didn't last very long, so his mother worked. I think she worked in a cafeteria. But she insisted on two things for this little boy we're talking about now. One is he get an education, and two, that he play sports. And she was good at that. She followed up and made sure he did that. But her life was mostly dominated by alcohol. The Red Cross contacted him about 8 years ago to say that she was ill and dying. He made it back, and she was in a coma, and she died. He said, "I cried for a minute or two, and then I stopped. I never felt anything after that." The interesting thing about his mother, in addition to her drinking and her emphasis on education and sports, was that the cause of her death was found in an autopsy and put into an envelope which he has never opened. He said he really doesn't want to know the cause of her death. Now, his dad was a handsome man who took a great deal of pride in his exploitation of women, and women found him attractive, so he had no problems finding women. This is the way our soldiers spent Christmas as a child. He said, my luggage never left my father's car. We would go spend a few nights with one woman and move to another house, spend a few nights with that woman, and that's the way I spent my Christmas vacation." He said, "I did not like my dad, but in some ways I am like him." He played middle linebacker on a high school football team, He said he was a mediocre player, but he was a starter, and he played every game, and he had no interest in going to college. He went on to the Army, and he moved up the ranks pretty well. He's a sergeant first class, responsible soldier, but he recently noticed that his wife was not treating him like she used to. He has a 3-year-old daughter, and he said, I went home because she's geographically separated from him, and I had a 4-day weekend, and she kept bugging me, so I put my hands on her. She called my unit, and now I'm on a no contact order. I can't see her at all, or contact her in any way, and I only can see my 3-year-old daughter under certain circumstances. He said that led me to do more drinking. I got more depressed, and I went into a hospital. He spent 28 days in a psychiatric hospital on the West Coast. He improved, he came back feeling a little better, and he was in my depression group, and then it was decided that I would work with his PTSD symptoms. The question is, what is the problem or the problems that makes anyone, especially a soldier with combat, unable to feel anything? And he's not interested in feeling anything other than whatever. Well, I want you to look at this with me, and you come up with your own suggestions about this. He said he had no meaningful attachments when he was growing up. He had some friends in the military, but unlike the stories I've most often heard, he had no real intense human bond with anyone in combat. Every once in a while he'll call someone that he was deployed with, or they may call him, but that doesn't excite him either. So we have a soldier then that is not exactly numb, and he is not exactly avoidant, but he doesn't have the capacity to feel. The closest feeling he has that really is an authentic feeling is the feelings he has towards his 3-year-old daughter. Now, when a soldier like this one talks about whatever, then my thought has to do with why live? Is he thinking about suicide? He said it would not bother him if he did not wake up in the morning. But he said, I assure you, doctor, I will not take my life. Now, he's competent to give and withhold information about suicide. And so I'm taking him at his word for that. He's going to participate, as I said, in individual therapy once a week. And we're going to continue some cognitive reprocessing therapy he started in the hospital. And he'll be in group therapy once a week as well. Now, here are the things that we call a differential diagnosis. What is it that would actually cause someone to have no feelings and to have whatever response? First of all, I wonder how common this is. It may be a form of depression. Some depressed people feel it's better to feel nothing than to feel sad. There's one theory about people rather to be bad than sad, to misbehave and to do that as a distraction, but not to feel sadness. So that's one differential diagnosis here. PTSD does cause a change in one's capacity to relate, and that's commonly mentioned in research and in dealing with soldiers where they don't feel close to people, but this seems to me to be more than that, especially since he feels, quote, detached from everyone. Now, you might imagine if you could feel detached, was there ever a time that he was attached? He hasn't said that yet. As I said, this is very early in the therapy. But I'm looking for help, and I'm looking for your interest in this, particularly in dealing with what I'm calling a puzzling case. I think that the essential things that I've been dealing with and I think helping soldiers with is improving their attachments. It's the first time in my memory in 10 years that I've had a soldier with no attachments whatsoever and no history of attachments. At the time that his attachments would have begun in early life, his mother was a single parent, and her life soon became dominated by alcohol. His father, whom he saw only on special occasions, was in the business of exploiting women and probably distracting himself from his own problems. He had been hospitalized once, the soldier said, that is his father. His father had 2 tours in Vietnam. That may be a factor. His father may have found his solution to his problem by staying occupied with women and with sex. We have a little boy here who was never close to his grandparents, never close to his mother, never close to his father. Interestingly, a recent Christmas, the soldier attempted to get his father's family together to see if they could have a, quote, real Christmas at last. He called up and his dad said, well, I'm kind of busy, I don't know. He raised his voice and yelled at his dad. He said, I mean this. He said, I'm going to pay for everything, and I want everybody in the family there. His dad has several brothers. They were grumbling, but they came. They sat around the table and they had kind of a quiet Christmas lunch together. The grandmother, still living, had given each of the uncles $50 as a Christmas present, including his dad. Each one of them gave the money to the soldier to pay for the expenses that he went through for the dinner, which he said I didn't like, but I took it. He came away feeling that was an unrewarding, unfulfilling experience. In other words, there is almost no pleasure, no sense of meaning in his life at all. And when I asked for the beginning of this, when did this start? He said he thought it had been there always. It may have gotten a little worse after his first deployment. He's had 4 deployments, a total of 52 months in combat. It may have been worse after the first one, but he's never felt close to anyone. Now, if you have any questions about that, and I want you to have questions, I want you to think about this. Let me know whether you've ever felt that way, and whether you're having any trouble with your attachments. It's a puzzling case, but it's a challenging case. And this is an intelligent young man, 33 years of age. He's nearly finished his online education for a bachelor's degree. And it looks like he's going to be coming out against his will on a medical board, and he'll get education benefits, and he intends to go ahead and continue his education. That's about the only thing he's looking forward to. They say that a well-trained psychiatrist makes the diagnosis in the first 3 minutes of the interview, and the rest of the hour is spent in confirming the diagnosis or changing it. I can put some of the pieces of the puzzle together. That is, the early deprivation, the early lack of parenting, the early absence of meaningful relationships. And I know this for a fact. If there's one single thing that can be used to predict whether a soldier will get PTSD or not, it's childhood abuse, neglect, or exploitation. So he had the setup for PTSD, and he's got a full-blown case of PTSD and alcoholism and depression. Alcoholism, we do know, has an influence from genetics. So he's inherited some of his tendency to become an alcoholic from his mother. I don't think anybody who becomes attached to alcohol wants to do it that way. It becomes an escape for them. There may be some pleasure in it in the beginning, but after a while it's just a horrible obsession. He's trying to convince me that he's sicker than he really is. What about the idea that he's so depressed that he really believes right now that his memory has been affected? He can't even remember the good times. That's part of what depression is. You can't bring to your present mind memories of the good past. So let me now review. A soldier who is now saying that he has no reaction, he calls it the whatever response. We've talked about the startle response. He's got an exaggerated whatever response. Nothing is meaningful to him. It could be coming from his depression, from his childhood, from his hopes to get out of the Army with some compensation. If he went back to combat and had no feelings, no attachments, and no feelings would preserve him, no attachments would make him at risk of being killed, because they save each other's life based on their attachments. So his solution has come up to be a fairly natural one. Don't suffer the pain of getting close to somebody and losing them, because you're going to be on the move. I see that fairly often, especially if soldiers become attached to someone who's killed, more than one who've killed, close ones. They make up their minds never to become attached again like that. And that's kind of sad, no question about it. But to summarize all of this towards the end here, I think this has been a fruitful discussion. Let's start being the team member you were in high school or in the Army, and work with the team, the group as a team, in group therapy. Work with me as your therapist as a team, and let's even get back the good feelings.